Good morning, y'all. I'm so sorry for being late. I got held up in a meeting earlier, so this day is off to quite the start. I'm really sorry for having y'all wait like that. I'm just pulling some things up and then we can go ahead. I'll do the little debrief and all that good stuff. Amanda's here. Okay. Just making sure I let in anyone who is waiting. Just waiting on two of our presenters, but that's okay. I will go ahead and get started for us. So thank you all for being here. I'm really looking forward to today. Again, apologies. Hello, everyone. Thank you so much for joining us today in the This is Public Health Graduate School Mini Virtual Fair. My name is Alicia Kuyate. I'm the Outreach and Recruitment Coordinator here at ASPPH, and I'm really looking forward to today with you all. I think it's going to be a great webinar we have. So I want to start off by mentioning that we will have a chat section. You're welcome to ask any questions to our presenters about the presentation, about the application process, their available forms, and all that sorts of stuff. Give another reminder to our attendees to please mute yourself while you're in the presentation, so we'll be able to clearly hear our presenters today. I also want to remind everyone that you will be able to change the layout of today's presentation to just see the speaker and their slides going on. I know some of our attendees like to just have a clean view, so I'm going to leave this up for a second that has some instructions on how to do that. And now to the good part, we get to see who our presenters are today and what schools we'll be able to hear from. So I have our list of schools right up here, and so you can see the order that we'll present in. Each of these members will be available at the end of the presentation, so in 1 hour for a breakout room. So that'll be a time we can ask some questions, go in more detail, hear about the application process, and all that really good stuff. So I'm really looking forward to answering your great questions later on today. So without further ado, I will go ahead and let us get started with Dartmouth.
Hello, everyone. Happy Tuesday. I'm going to pull up our slides for you. Great. So assuming everybody can see the slides, I just want to do a quick introduction. My name is Amanda Stefesky. I am the Assistant Director of Admissions and Recruiting at the Dartmouth Institute, which is affiliated with the Geisel School of Medicine at Dartmouth College. I am also an alum of our residential MPH program, which I'm excited to speak to you more about today. And that's an opportunity for us to discuss further in the breakout rooms. But without further ado, a little bit more about Dartmouth. So the college itself was founded in 1769. It's a private Ivy League research institution located in Hanover, New Hampshire. That's about 2 hours from Boston by car, or 5 hours to New York City by car. There's something wonderful called the Dartmouth Coach, which runs multiple times each day, taking you to those two locations, picking you directly up on campus and taking you to Boston Logan Airport, South Station in Boston. So there's many opportunities to kind of balance those logistics where you don't need a car in order to attend an in-person program at Dartmouth. The medical school was founded shortly thereafter. All of our degree programs are granted by the Geisel School of Medicine. So we'll talk about a few different degree programs that we offer, but each of those, when you receive your diploma, it is granted from the Geisel School of Medicine. The Dartmouth Institute, which is really this umbrella underneath the medical school, we are the health services research group at Dartmouth College. So we are comprised of researchers, faculty, students. There's an education wing, which is where our learning programs take place, and also a research center, which is housed at the Dartmouth Hitchcock Medical Center. And most of our faculty are kind of splitting their time between those two locations. So you're learning real world skills, and they're trying to apply it in a way in the classroom in a way that is applicable to real world research that is happening right now. What sets Dartmouth apart is our comprehensive curriculum. So We do not have specialty tracks or concentration. You are earning a Master's of Public Health, or we also have a Master's of Science in Healthcare Research. But these 3 boxes that you see, these are what we call our pillars. This is what we are building our curriculum around. And then you have the opportunity to kind of study a bit more in these areas whenever you are taking some electives. So under each box shows an elective that is kind of focused in these areas specifically. But again, these are 3 pieces that are interwoven into each class that you take at Dartmouth. So about our degree programs, we have 2 residential programs that are 11 months in person. So just 4 terms. You still have practicum opportunities. So you have the option to do an internship, an independent research project. Those studying on campus also have the opportunity to complete graduate level courses at the Tech School of Business, Thayer School of Engineering, and Geisel School of Medicine that would count towards your elective credits. We also have an innovative 22-month hybrid delivery. It does require 3 visits to Hanover each year, so a total of 6 visits. We have those dates well prepared for you so you can build it into your schedule. And the only other live part that you need to schedule around is a weekly 90-minute Zoom call that happens every Thursday, and it always that stays consistent throughout your 22 months. The time will never change. A bit about our accelerated on-campus program. Again, 11 months, you're taking usually 5 courses at a time. Each cohort that enters is about 55 students, and we estimate it to be about 55 hours a week. This is a typical breakdown. We use a block schedule. So classes will happen Monday and Tuesday, and then another set of classes, usually Wednesday, Thursday. Friday is left open for additional enrichment opportunities or exam preparation, alumni panels that come on to campus. So we leave Friday as this additional day for some extra learning opportunities. Our 22-month online hybrid program is just 1 class at a time. It's really designed for working professionals, typically about 40 students and 15 hours a week expectation. All of your assignment due dates will remain the same throughout your 22 months, even though you're only taking 1 class at a time. You can see on our screen a little bit about our class profile. These are just updated last week. So this is the most current cohort that is currently in attendance. I would love to speak to you a bit more about our lifetime career services, about our employment outcomes. 95% of our students are employed within 3 months of graduating. Again, these are slides that I would love to share with you in the breakout room, trying to be respectful of my friends that are also here to present. But finally, I did just want to share that our priority scholarship deadline is December 1st. Our application requirements are on our website, and the GRE is optional. I'm going to leave this slide that has my contact information, maybe. If you wanted to take a screenshot, reach out to me, but I did want to go ahead now and pass it over to my friend Trisha with George Washington.
Thank you so much, Amanda. I'm going to share my screen here. Let's see. Hopefully that looks great to everybody. Hi, everyone. My name is Trisha Rilbuta. I'm the Assistant Director of Admissions for the Milken Institute School of Public Health, and I appreciate your time today. So I want to speak first about why GW and why the School of Public Health. So the first point is location, location, location. So we are the only school of public health in Washington, D.C., and one of the largest schools of public health in the country. And why that is important is because the city and our school really becomes your home and your living classroom as well. So anything and everything related to public health is coming through Washington, D.C. So opportunities for internships and research and things like that are very important to us. As well as our world-class faculty, we have faculty who have taught and researched all over the world and are there to be a resource to you as well. Also flexibility. For our residential MPH program, students are able to take up to 15 credits of their 45 credit program online. So you have some flexibility there. And then also the power of GW. We do have over 200,000 living alums that you will include yourself with. So this is our beautiful building. We're located at 950 New Hampshire Avenue in Washington, D.C. We are open for visits and for tours if you'd like to come in person. We have tours and visits during the week. We also offer lots of virtual events, and I can talk more about those with you in my breakout room later today. So we do offer 7 different departments within our school of public health. So we have biostatistics and bioinformatics, environmental and occupational health, epidemiology, exercise and nutrition sciences, global health, health policy and management, and prevention and community health. So this is the list of all of our academic programs. I'm not going to read all of these to you, but I do want to mention that we do have 15 different concentrations of our MPH program for our residential programs. And no matter what concentration you choose, students are taking all of the same core courses. So everyone in our programs is taking an epidemiology course, they're taking a biostatistic course, they're taking a health policy course. So everybody's getting that same foundation throughout their program. We do offer some MS programs. We offer an MHA program as well. We are one of the few programs left in the country that does offer a third-year fellowship program as part of our MHA. We do have a DRPH and some PhD programs as well. So we have a lot to offer for our students. I want to talk briefly about our application requirements. I'm guessing, like most of my colleagues in schools today, you'll apply through SOFIS. We do require official transcripts. If you're applying for our PhD programs, the GRE is required. But for any of our master's level applications through spring of 2024, the GRE is not required. We also ask for 3 letters of recommendation, a statement of purpose, a resume or CV. If you're applying for MHA or any of our doctoral programs, there may be an interview as part of your process. And for my international applicants, and I know that we have, from looking at the chat, we have lots of international students here today. We do ask for a transcript evaluation and then language proficiency scores, and we can talk a little bit more about that in the breakout room as well. I just want to mention our application deadline. So for anybody interested in starting in the spring in January with us, our deadline is October 15th. So that's coming up soon. For summer and fall for our master's students, our priority scholarship deadline is January 15th. So you're going to want to be submitted and verified in SOFIS by January 15th. If you're interested in the MHA or any of our doctoral programs, they only start in the fall. And the deadline for our doctoral students is December 1st. But our final deadline is March 15th for all of our programs. I want to mention briefly our cohort of students who just started with us a few weeks ago in our 2022 cohort. So we have almost 300 students starting in our residential master's level programs for incoming class this past year, 3.51 undergraduate GPA, average year of work experience 1, and age 26. As you can see, our doctoral students a little bit older. Our GRE scores there for our DRPH program. Students are required to have at least 4 years minimum of work experience, but are coming in with an average of 6. We have about 50 doctoral students coming with us, starting with us this fall. So that's about the end of my time. Here is our email address. You are able to schedule an appointment with our office, and then we offer in-person and virtual events as well. So we'll all be able to connect with you and share more of that in my breakout session. But now I would like to pass it off to my colleague Lauren with Johns Hopkins.
Great, thanks so much. Just pulling up the screen, I'll be right there, and bring it into full screen so all of you can hopefully see that okay. My name is Lauren Black. I'm the Director for Recruitment, Communications, and Events at the Johns Hopkins Bloomberg School of Public Health. To jump right into it, our School of Public Health is ranked #1 across schools and programs of public health. We're proud of the students, faculty, and staff that are part of our programs, and we have over 27,000 alumni across the world. There's lots of choices as you're thinking about a degree program at our school, including master's programs, doctoral programs, different certificate program opportunities, and different opportunities to complete fully online. At our School of Public Health, we have over 3,000 students that are supported by our part-time as well as our full-time faculty. So you'll get connected to a great advisor, have wonderful mentorship opportunities, as well as have the chance to participate as either a research assistant or maybe even a teaching assistant. We have about 80 different centers to be a part of, so we encourage you to really explore the different opportunities that you may have as a student here at our School of Public Health. Within our School of Public Health, we offer 10 different academic departments and also have a number of master's programs, including professional as well as academic-based programs. We have programs that you can complete that are going to be in the basic science areas of biochemistry, molecular biology, molecular microbiology, and immunology. We also have some cross-cutting areas that connect to different departments or schools within our university, including environmental health and engineering, which partners with our Whiting School of Engineering. We're one of the only schools to offer a mental health department, and then have departments that are more practice-based, including our health behavior and society, focusing on health communications and health behavior focused research, health policy and management, as well as population, family, and reproductive health that highlights work within maternal and reproductive health, family planning, and women's and reproductive health and child and adolescent health work. For those looking to do our MPH program, I just wanted to kind of highlight this program does typically require at our school about 2 years of health-related work experience, but can also be completed as a part-time program. As a full-time program, it's 80 credits here in Baltimore. Great ways to connect with those interested within the field of public health. You'll get connected to a concentration within our 10 different academic departments. If you maybe don't have that work experience and are looking for more of a practice-based approach, we do offer the MSPH program. That's going to be offered in a few of our departments, including health behavior and society, health policy and management, international health, and population, family, and reproductive health. Within our school, we also offer different research degree programs, including work within all 10 of our academic departments, and MHS offers great research experience as well as experience within our SCM program that builds on top of that research, including a thesis topic. All 10 of our academic departments also do offer our PhD program. Our PhD is a full-time doctoral program, and then our DRPH is a part-time program. Our DRPH does require 3 years of public health related work experience as well as an MPH. Most of our other master's programs and doctoral programs don't have work experience requirement, but we can certainly dive deeper into any of the programs we've listed to talk any questions that you have regarding those programs. Our application process is very similar to my colleagues. We are through SOFIS and asking for many of the general information. We also have our test scores in general are not required as far as the GRE. If you need to submit an English test score, that's still something that would be required, but as far as the GRE, it's either optional for most of our programs or not required, not reviewed, and happy to dive in further what that kind of means across our different departments and programs. I wanted to quickly highlight our scholarships. These are at the school-wide level, and then some of our departments will also have scholarships available. And some things that really students can take advantage of are our student groups, SOURCE, our community outreach and engagement, as well as support services throughout our School of Public Health. I want to leave this information here so you can connect with us after today, and also to connect with us for our different information sessions throughout the fall. So we look forward to hearing from you in the breakout session. Thanks, everyone. And now I'll turn it over to Sacred Heart.
Thank you so much. Hi, everyone. I'm just going to pull up my screen really fast so we can get going. Okay, so hi everyone, I'm Eva Magnuson, Director of Graduate Admissions at Sacred Heart University. And here at Sacred Heart, we have a Master of Public Health program. So our program emphasizes community health. So that's something that you're going to get throughout the curriculum here. We're located in Fairfield, Connecticut, which is about an hour and a half drive outside of New York City, so great location. The program is 42 credits. Something I definitely want to emphasize is our small cohorts. This allows for a lot of individualized attention from our faculty. We also have very flexible scheduling, full-time, part-time. Our program is pretty much on campus. There's some options for hybrid with some online courses within those, kind of on-ground delivery. We are STEM designated and fully accredited. One thing that I'll go in more detail on in the breakout sessions are the different options for that flexible scheduling. We have an accelerated plan of study, which will take 1 calendar year to complete. This is really for those highly motivated students potentially going into the medical, dental, or doctoral level profession. Then we have our full-time plan of study, which is 15 to 18 months. This program or plan of study is great for students who are really looking to potentially take advantage of our graduate assistantship opportunities within the Department of Public Health. And then we also have a part-time plan of study, which depending takes 21 to 33 months, however many courses you're taking each semester, that will be up to you. And this is really for the working professional. Application requirements, very similar to all my colleagues here applying for SOFAS. There is no GRE requirement for our program, nor is there specific prereqs that need to be completed, nor do you have to have specific experience within the public health sector. We do have those traditional application materials that most schools require: letters of recommendation, personal statements, resume. Again, we can go over all of these specific requirements and as they pertain to international candidates as well in the breakout room. And here is my contact information, as well as the program director, Dr. Jackie Finarelli. She is happy to answer any student questions or applicant questions that students may have. All righty. And now I'm going to turn it over to the University of Miami.
Perfect, thank you. Go ahead and get the screen. Perfect, so good afternoon, everyone. My name is Janelle Solis, and I'm the Associate Director of Admissions here at the University of Miami, the Department of Public Health Sciences. So today we're going to be quickly talking about the various different types of programs that we have to offer. Primarily, the conversation is going to be geared towards the Masters of Public Health and our Master of Science in Public Health programs. However, we do have a Master of Science in Biostatistics, Climate and Health, Prevention Science and Community Health, and we also have 3 doctoral degrees. And then for those that are interested in joint degrees, we do have 6 currently organized. In terms of the top reasons why students choose the University of Miami, we do offer a variety of graduate programs. So you can choose from over 15 master's, joint, and doctoral degrees, with each degree giving the flexibility to match what interests you. So you are able to group your electives in an area that you find most interesting. We do have various research opportunities as well. So currently our faculty are engaged in more than $300 million in research, which allows students to work and collaborate in various research endeavors. We're also located in Miami, which provides students a broad range of opportunities to study in a location that uniquely prepares them to be a public health leader. We also provide scholarship and financial support. So at this time, all our programs provide a scholarship, with the MPH and MSPH giving one student a full ride. So it is correlated with our resiliency scholarship. So as long as you apply prior to the priority deadline, you would be considered for that award as well. We have faculty support. So at this time, we have over 40 full-time faculty members involved in interdisciplinary research. We have an in-house office of career services. So at the University of Miami, you have the general career service office, but we have one specifically for our students. So you'll be able to participate in networking events and engage in panel discussions and mock interviews. We draw students, faculty, and patients from around the globe. In the last class, we had 33% of our students were from out of state and 32 were from an international location. So we do have a very diverse student population. And then we are located on the medical campus. So we're not necessarily a school of public health. We are housed in the School of Medicine, which allows students to network with different medical professionals. So in terms of department highlights, all our programs are fully accredited by the Council on Education for Public Health. Our students have completed their capstone projects and thesis in over 45 countries. So if traveling with research is something that interests you, you'll be able to have that opportunity over here. And as I mentioned, we do provide a flexible curriculum. So you can have your electives in biostatistics, environment and public health, EPI, health service research, and more. In terms of our capstone and thesis project, it just depends on what area you are going in. So if you're going to be completing an MPH degree, you will be completing a capstone project. Some local partnerships that we have established include the Needle Exchange Program, the Pediatric Mobile Clinic, and more. And then if you are interested in an international or working with an international organization, these are the ones that we currently have established, but this is just a small list of the many that we work with. So you can work with the World Health Organization in Geneva, the CDC in the Dominican Republic, and more. And then if you were doing an MS program, you would be doing a thesis. So these are just some topics that students have currently finished. In terms of being career ready, our students are able to develop this skill set throughout the program. And our top employers include the American Cancer Society, Baptist Health, the CDC, Florida Department of Health, and of course, the University of Miami and UHealth. So we do employ a lot of our alum. In terms of admission next steps, the program deadlines are on this screen. So if you were interested in starting in the spring, the priority deadline is November 1st with a final deadline of December 15th. And then for fall, March 1st is a priority deadline, and the final one is July 15th. And then our 3 doctoral program deadlines can be found below. In terms of our application checklist, all applications are received through SOFAs. And on that portal, you would be submitting a statement of purpose, a CV/resume, at minimum 3 letters of recommendation, all transcripts from all institutions attended, and the GRE is only required if you were interested in the PhD in biostatistics or EPI programs. Besides that, you would not need to submit the GRE score. For international applicants, the only additional item is a course-by-course evaluation through the World Education Service, as well as a minimum of a TOEFL or IELTS score. In terms of connecting with us, hopefully you're able to connect in the breakout session, but if not, you're more than welcome to engage with us on social media, sign up for a virtual visit. On the first Friday of every month, we offer a campus tour. So if you're interested in signing up for that, you could let me know. We also have a lot of virtual programming, as well as our open house, which is scheduled for November 2nd. So if you want to attend and learn more information about our programs, we would welcome and look forward to seeing you there. And so with that, I want to thank you all, and I'm going to be passing it to the University of Michigan.
Looks like my slides are loading here. Awesome. Can everybody give me a thumbs up just to make sure we're good to go before I start?
That's good.
Okay, perfect. Thank you. Good afternoon, everybody. My name is Mary Beth Carroll, and I oversee our recruitment and admissions team here at the University of Michigan School of Public Health. This slide contains a picture of our school. Michigan Public Health is pursuing a healthier, more equitable world through education, research, and action. And as a graduate from our school, you'll become part of one of the world's largest alumni networks. This degree will give you worldwide recognition, no matter where life takes you. Let's take a turn and get to know a little bit about Ann Arbor and our public health community. Our students are lucky to be able to live and learn within Ann Arbor, a very lively college town that's consistently ranked as one of the best places to live in the country. There truly is a place for everyone within our community, and Ann Arbor draws people from all walks of life. To give you a little bit of a sense of where we're located, we're about 35 miles outside of Detroit, and Ann Arbor has many of the same metropolitan feels as a larger city, but on a smaller scale and a much more affordable cost. This slide here talks a little bit about the University of Michigan, but wanting to also echo some sentiments that our students receive as a public health student. With that being said, you'll join a top-rated program with a long-standing tradition of excellence. We were founded back in 1941, and this is where Blue Cross Blue Shield was created. The National Sanitation Foundation was founded, believe it or not, where the first Earth Day was held, and where flu mist was invented. The polio vaccine was even proven to be safe, potent, and effective here at the University of Michigan. Our institution, as well as the School of Public Health, have consistently earned top rankings for the programs and resources that we offer. And this slide talks a little bit more about our school specifically. If you are interested in research, our portfolio typically consists of over $80 million a year. And for a little bit more context, we are composed of 19 different schools and colleges that make up the University of Michigan. So there's flexibility built into the curriculum to allow you to take courses at any of those colleges outside of the school, with the ability to really learn from leaders within all different disciplines, no matter what your area of interest is. You really are able to tailor your degree to exactly what you want it to be. This slide talks a little bit about our different degree programs that we offer. Flexibility is key here at the University of Michigan. And with that being said, I want to note a couple differentiators in terms of degrees that we offer. One being our fully online MPH in Population and Health Sciences, where students are able to elect certificates to further diversify their experiences and tailor their degree. In addition to that, we also have an Executive Health Management and Policy Master's in Health Services Administration degree program as well. There are also a number of dual degree programs that are noted over to the right-hand side there. Interdisciplinary research and learning is at the forefront of everything that we do, as I shared a little bit more about earlier. Like many of my peers on the call today, the standardized test scores are not required. In addition to that, in an effort to be inclusive and to attract more applicants, new this year, our school has also removed the supplemental fee to apply to the University of Michigan School of Public Health. So with that being said, the only fee that will be associated with applying is directly through SOFIS. We no longer take any more fees. So excited to share that. And of course, we're here to help and support you throughout the process. We understand that it can be very tedious and time consuming, and we very much appreciate all the effort that you put in putting together a competitive application. I look forward to meeting with you all in the breakout rooms, and I'm going to turn it now over to the University of Washington in St. Louis.
Thank you, Mary Beth. If you wouldn't mind stopping your screen share, then I can start mine up. Thanks so much. Good to see everyone here. Good morning, good afternoon, good evening, wherever y'all are coming from. I'm going to pull up my slides. And we'll get started. Awesome. So my name is Sarah Dexter. I use she, her pronouns. I am an associate director of admissions and recruitment at the Brown School in Washington University in St. Louis. I know it's a really long name, but essentially we're the Brown School and we're located in St. Louis, Missouri. This is a picture of one of our beautiful buildings, Hellman Hall, where the majority of our MPH classes are held. So to give just a really quick overview of kind of who we are by some numbers, the Brown School has 3 graduate programs. I'll primarily be talking about our master's in public health, but we also have a master's in social work and master's in social policy. Similar to some of these other programs, we have a fairly small student to faculty ratio, 9:1, with class sizes averaging about 20 students per class. We have a ton of research opportunities, if that's your jam, 20 faculty affiliated research centers just within the Brown School.
not to mention our associations with the medical school and other schools on our campus. We have a ton of practicum sites, depending on what your interests are. And then for funding, 100% of our students who request scholarship do receive an award. So I'll say that again, 100% of students who request scholarship do receive an award. That certainly varies, and I'd be happy to chat more about that in a breakout room later. So we often get the question, why social work, public health, and social policy? Why all these programs under one roof? So we feel that this puts us in a really unique and cool position to advance education and research in these areas and take a really transdisciplinary approach to some of societal's complex problems. So COVID-19 is a great example of that. While these issues are not new by any means, COVID did really bring into focus some of the health impacts of income inequality, racial health disparities, mental health issues, as well as the inadequate policies that were put in place. And again, this is not a new issue, but this is something that we feel has really been brought into light in the recent years. One of our faculty members says it really, really well. So I'm just going to read a quote from her. But Dr. Thompson says, if we as a society have disparities in income and education, we will have disparities in health. People can't begin behind and just miraculously catch up bearing something extraordinary. So teaching and research, I want to make the extraordinary possible. So we feel like that really summarizes why we have these three seemingly different programs in one school. So here's a really quick overview of our curriculum. So it's really rooted in this transdisciplinary approach, focusing on health equity, rooted in science, rooted in research, but applying those skills that you learn. So we have 6 STEM designated specializations. We have a generalist track, which is kind of like a choose your own adventure. We have an epidemiology and biostatistics track, global health, health policy analysis, mental and behavioral health, as well as urban design. We also have 2 optional certificates, one in violence and injury prevention, and a new one that's launched this year, artificial intelligence and big data analytics for public health. Our program is a 2-year program, primarily in person on campus. First year is really rooted in that foundation level coursework. So regardless of where you decide to work throughout your career, you're going to have a really strong foundation in the field of public health. Over the summer, you will have your practicum or field education experience. And then your second year is really going to be focused on your specialized coursework. So whether that's global health, biostatistics, health policy analysis, so on and so forth. We do offer dual degrees, as you could imagine. So if that is something of interest to you, if your passions lie in the intersection of social work or policy and public health, we definitely have those options. So you can essentially get 2 degrees in 3 years with our dual MSW MPH or dual MPH MSP. We also offer a number of joint degree programs across Washington University listed here. Our application requirements are seemingly very similar to those of my colleagues' institutions. We are located on SOFAs, of course, and then here are our list of requirements. We do require a human biology prerequisite. However, many students are admitted without that course completion and are just required to complete that by the end of their first semester. We have some important application deadlines here. So December 1 is our early action. For those interested in scholarships, we recommend applying early. And then we have March 1 regular decision, enrolling in admissions after that. Here you can see our email if you have further questions, or please pop by the breakout room. And then a couple other things here. We do a lot of virtual info sessions. And so next month we have one for submitting your strongest application, one devoted to our international student experience. And then in November, I'll be hosting an info session for y'all to ask us anything. So I really hope I'll get a chance to chat with some of you later on in the breakout session. We do virtual visits, in-person visits, and then a variety of different opportunities to connect. So I will stop sharing my screen, and I look forward to chatting with some of you later.
Hello, so huge thank you to all of our presenters today. It was really wonderful to hear about your schools and your programs and all of that good stuff. I do want to take just a second to share our upcoming virtual fairs with our attendees today. We have one coming up on Thursday. We actually have two next week. You can see more of our upcoming This is Public Health events coming up via the link that is down there. And I will also leave it for you in the chat. Now, though, it gets to the good time where we can get to our breakout rooms. So my colleague on the call, Anthony, will be sure to open up the breakout rooms for everyone here. This will be an opportunity for you to talk with these presenters that we had today, ask specific questions about their programs, application process, all of that good stuff. There's some instructions on the screen right here for how you join the breakout rooms. So you guys, we'll go ahead and open them up for everyone.